Right, let's expand the conversation now, roping in Head of Research Capacity Development at the University of Pretoria, Dr. Rakeshnie Ramoutar-Prieschl, who joins us now for more. Very good evening to you. Thank you so much for your time. We're learning that South Africa is ramping up its response against mpox after deaths were reported from the infectious disease. I mean, government officials, for one, are turning to donors to secure potentially life-saving drugs. But then again, questions on why such requests are necessary when wealthier countries are sitting on large stockpiles are gaining momentum. What does such a request showcase about South Africa's status regarding the production of various vaccines?
Thank you, Paul. I think vaccine import dependence in sub-Saharan Africa continues to be on the rise. As an example, we are speaking of mpox earlier today, and about 10,000 mpox vaccines are finally due to arrive next week in Africa. And Africa has actually been afflicted by this disease for decades, and it's only now being a cause for global alarm. It's now pushed for us to get the requisite approvals to get that first batch of vaccines. And the slow arrival of these shots, which have already been made available in more than 70 countries outside of Africa, shows that the lessons drawn from the COVID-19 pandemic about global healthcare inequalities, especially the inequitable access to vaccines, are actually very slow to bring change. And Africa, as an example, consumes about a quarter of the global vaccines by volumes, and yet it only manufactures less than 1% of the routine vaccines, with almost no outbreak vaccine manufacturing capability in place. But there is hope in South Africa particularly. We have the BioVac Institute, Aspen, and Afrigen. BioVac, as an example, has entered into technology transfer agreements with about 2 or 3 pharmaceutical giants. And they're now able to do formulation, fill and finish on vaccines such as hexapium, hepatitis B, polio, and recently the oral cholera vaccine. And Aspen, on the other hand, has done another agreement where they do fill and finish for a number of vaccines on the National Department of Health's expanded program for immunization supported by Gavi. So there is significant progress in our country, but progress on the continent is quite slow, despite the fact that we have about 23 manufacturing capabilities on the continent.
Yeah. You say that, we've known for a very long time as a country about mpox, and I suppose as a continent at large, but only now, we're trying to find solutions and getting the correct vaccines. What does this indicate about some of the red tape and the shortfalls that South Africa has, as well as the continent at large?
This is an interesting one because it seems that the journey towards becoming a hub for vaccine manufacturing capabilities in the country and on the continent is both challenging as well as promising. By focusing on enablers such as infrastructure, which is quite expensive, from state-of-the-art laboratories, good manufacturing practice laboratories, clean labs, WHO or World Health Organization pre-qualification facilities. These are critical ingredients, and these come at a huge investment cost. And alongside this, there are requirements such as workforce development, financing for R&D, as well as startups, strengthening our regulatory efficiencies, supply chain logistics and procurement plans on how we procure our vaccines during the tender cycle, collaborative efforts with global partners, community engagement, and enabling policy framework. In this regard, I'm saying we need all of government to speak from the same hymn book in this regard, about incentivizing investments, providing grants and subsidies, and creating a favorable business environment to drive a sustainable vaccine manufacturing industry in the country.
You made mention of regulation, which of course plays a vital role in ensuring the quality, safety and efficacy of vaccines in South Africa. How does that then ensure a level of trust and amongst South Africans and consumers accustomed to international pharmaceutical avenues?
So I think building trust with community is essential for the acceptance and uptake of vaccines. You know, we also have a generation of non-vaxxers at the moment, which now has seen diseases that were once combated emerge yet again. What we're finding is that the South African Health Products Regulatory Authority, or SAPRA, is in the process of ensuring that they have the highest level of accreditation to be able to inspect and approve locally manufactured vaccines. And these facilities also will provide the pre-qualifications that are required by the World Health Organization, and in some instances, the FDA in the United States and the European Medicine Authority. So in essence, transparent communication about safety and efficacy of vaccines combined with educational campaigns can foster this public confidence. Remember, the Omicron strain for COVID-19 was discovered here in South Africa. And despite that, the pandemic still underscored the critical need for sustainable domestic vaccine production capability, because it highlighted vulnerabilities in the way in which global supply chain and the disparities in terms of equitable vaccine access, especially by countries in the global south. These were absolutely anchored into how we're now responding in terms of developing sovereignty, self-reliance, and having control over vaccine production.
You mentioned the non-vaxxers as some of the, some of the components which lead to questions and trust around vaccines. And a lot of that sort of terminology, I suppose, came with the COVID-19 pandemic, where there were reports and suggestions that people had now succumbed to other ailments, or perhaps even developed other symptoms of other diseases and illnesses. How does that aspect now, what opportunity can government take there to build the trust and ensure that there is some sort of compliance and there's an agreement that vaccination is the way to go?
Yes, in order to combat pandemics and huge disease burden, we have to start focusing on moving towards vaccinations. I mean, this can save generations. Polio, which crippled half the population a century ago, now is almost eradicated. So the story here largely links to the fact that we need to build the regulatory authority, build the credibility, make sure that we understand the pros and cons of vaccination. And yes, the emergency protocols were activated for the release of COVID-19 vaccinations, largely because of the state of emergency that all countries were under. But normal vaccines allow for us to address disease burden like HIV, TB, malaria, even cancers, as an example. And cancer can kill more than TB, HIV, and malaria combined. So the HPV vaccine is critically important, especially for young adults. So I also believe that having this homegrown vaccine manufacturing capability gives us a healthier population, a more educated population, because this is where people need to have autonomy and independence about their own health interests, and empowering them to make the right decisions from an evidence-based approach. And this is where public outreach, public communication, and engagement with community, for the community, with a whole of society approach is critically important as we navigate future pandemics.
Yeah, absolutely. And very lastly, before we let you go, what type of environment should government work to develop to facilitate this ambition?
Yes, I think this is where we need to have a whole of government approach. We're very proud at the Department of Science and Innovation that we are leading a task team with the Department of Trade and Industry and the National Department of Health that are on board to help us look at what are some of the various incentives that are needed to develop a robust industry around vaccines. What is it that we need to do so that our procurement plans do not subject us to procuring vaccines outside of the country when we have the ability to manufacture some of them in the country? We also have issues relating largely to building a significant economic capability for our country by creating jobs, stimulating local economies and auxiliary industries, especially in cold chain logistics and transportation. So as government, we need to leverage our partnerships with private sector, big industries and pharmaceutical companies, with international parties to support what we are driving from a research and development capability, from infrastructure, skills to drive this technological innovation, not just for South Africa, but also on the continent in terms of developing the biopharmaceutical industry.
Absolutely. Thank you so much. Let's perhaps leave it there for now. Head of Research Capacity Development at the University of Pretoria, Dr. Rakeshnie Ramoutar-Prieschl, expanding on some of the elements and the vaccination project.